My name is Scott Blumenthal, and I'm co-founder of the Center for Disc Replacement at Texas Back Institute. So you've heard about maybe disc replacement in the cervical spine or neck, or you're watching this to learn about it. How do you know that this might benefit you? Well, the types of problems that we treat are problems involving the disc, which is the cushion between the vertebrae in the cervical spine. And the diagnoses are herniated disc or bone spurs, the symptoms of which can cause neck pain, pain or numbness or weakness down your arm, or in the case of severe disease called myelopathy, it can even affect your ability to walk. You may have been told that you need a fusion. You may have seen another surgeon. And this is an alternative which allows reduction or elimination of your symptoms and preservation of motion. Why preserve the motion? Well, number one, our joints were meant to move. Number two, it allows a more full and rapid return to normality, to normal function. And that's the real benefit. Interestingly enough, this is a type of surgery that we call minimally invasive. It's done through a small incision, often an inch or less, in the front of your neck in a skin line. If you look down, you see your skin folds. We try to do it in a skin line to make the most cosmetic result possible. The surgery, does not take very long, maybe an hour, hour and a half per level. You can go home the same day or the next morning, and sometimes you don't even need a collar. We like you to have a little bit of physical therapy afterwards, but by 6 to 8 weeks, you're pretty much released or feel free to return to normal activities. We'll take periodic x-rays to check that everything's working, but most importantly, the symptoms usually go away pretty much right away. When we make the decision, and we make it together, to do artificial disc surgery in the neck, cervical spine, we've got about a half a dozen different types of prostheses, types of discs that are out on the market. And we customize them to your anatomy, your specific problem. And fortunately here at the Center for Disc Replacement at Texas Back, we have access to the latest and most recently approved ones. And in fact, in many of these, we participated in the FDA trials, so we're very familiar with these discs. Why disc replacement rather than a fusion that's been done for decades? Well, much like what occurred in hip and knee surgery, we don't fuse those joints anymore for degenerative or arthritic conditions, of which a disc problem is. So this is just the natural evolution of technology with new materials, with new techniques, and frankly, we're raising the bar and getting better results than we ever got with fusions. In comparing disc replacement to fusion, the reoperation or need for further surgery in the future is much reduced, maybe as much as a third to a fourth. As much as 10% of fusions may not heal or cause problems at the next or adjacent segment. We found in our series of over 1,000 patients that our reoperation rate is really around 1%. So what are other benefits of disc replacement over fusion? You may have heard with fusion that once you have one, you might need another one. That's called transition syndrome or adjacent level disease. And what that is by eliminating motion, the motion is taken up by the next disc segment and it makes it wear out quicker. We found with artificial disc replacement that the chance of reoperation compared to fusion is maybe a fourth less than fusion. And patients find that significant in terms of making their decision. Why doesn't everybody with disc problems in their neck get an artificial disc rather than a fusion? And we found that in 100% of patients that come see us, 80% are candidates and 20% are not. So you need to go over this carefully with your surgeon. We do with our patients in every single case. And if their problem is better treated with a fusion, of which there are certain conditions which are, then we'll recommend that. But like I said, 80% of fusions can probably be done with disc replacement, so you really owe it to yourself to get a consult with an artificial disc surgeon if you've been told that you need a fusion for a disc problem in your neck. I'm Dr. Scott Blumenthal, co-founder, Center for Disc Replacement at Texas Back Institute, and come see us.